Hi, my name is Grace. I'm a physical therapist here with Kaiser at Redwood City, and I just want to welcome you to the self-myofascial trigger point release video. The objective of this presentation is to identify common trigger points for the upper and lower body, to demonstrate how to perform a self-trigger point release, and thirdly, to instruct you on how to do some stretches and gentle exercises following a self-trigger point release. Before we begin, I just want to point out some caveats. Often there are multiple factors for a pain condition, and in this video we're going to focus on the musculoskeletal component of pain. This is an introductory video that's intended to familiarize you with myofascial trigger points and how you can safely and easily release and work out the trigger points at home for pain relief. Recognize that chronic pain is multifactorial and all of your symptoms may not be alleviated by relying on this technique. A multi-modal and comprehensive approach to pain management that addresses the biological, psychological, and social factors will be the most effective in the long-term management of pain. If you need additional help with addressing multiple factors contributing to your pain experience, contact your doctor to discuss an individualized plan. So let's get started. What are trigger points exactly? Trigger points are defined as discrete focal hyperirritable spots that are painful on compression and can produce referred pain or tenderness, as well as problems with muscle function. These contracted knots in the muscle can feel like a pea or a partially cooked piece of spaghetti buried deep in the muscle. Under a microscope, trigger points show up as a localized tight band of the muscle fiber, indicating that these muscles are in a state of constant contraction. Oftentimes there are multiple tight bands that make up a larger area, like the size of a dime or a nickel. So to the touch, pressing firmly on a muscle with trigger points will hurt where you're pressing. It might actually make you jump or wince or pull away. And trigger points can also sometimes send pain up and down other parts of the body. So what causes trigger points to develop? All of us develop tight bands in our muscles as we go about life, but some more than others. A trigger point might develop following an acute muscular sprain, overuse, emotional and mental distress, such as during a car accident, a fall, a sprain or fracture, or excessive or unusual exercise. It can also develop following chronic overload of our postural muscles because of prolonged or poor posturing during work or sleep habits or by repetitive work tasks. In terms of the biological mechanism, what's actually happening to the muscles when trigger points develop? So when the muscles become chronically tight due to the things that I mentioned earlier, the muscle fibers can actually squeeze the capillaries or tiny blood vessels and consequently reduce blood flow into the area. The result? A cellular environment with reduced oxygen and a progressive accumulation of cellular waste products. And that can actually cause more muscle fibers to contract as a response. It can attract inflammatory cells, which can make that area very irritable and sensitive to touch. Over time, the way that muscles and nerves communicate can be altered, and this can actually amplify the sensitivity of pain in the body and bring about a chain reaction of nerves becoming more sensitive and on guard. How do we find trigger points? So thankfully, referred pain occurs in predictable patterns, which have been meticulously mapped out by some physicians, researchers studying trigger points. So there are some resources that contain maps and guides on how to find trigger points throughout the body, including the Trigger Point Therapy Workbook by Claire Davies and Amber Davies, or following website www.triggerpoints.net. Active trigger points reproduce symptoms locally, and at times it refers to other areas when you press on it. Latent trigger points, on the other hand, don't cause pain, but they can actually easily become active by stress, strain, or overuse of the muscles involved. When you're looking for a trigger point, feel for tight bands within the muscle and localize an area within that band, which is especially tender, and most likely that is the trigger point. As you press, that muscle may twitch, and if you actually keep pressure on it, it may cause some referred pain or pain in another part of the body, which confirms that you are on the right spot. Note that there might be multiple trigger points that you need to explore in order to help relieve symptoms. So how do we read the body maps? Really briefly, you'll notice that on these maps you'll see an X, which points out the location of the trigger point. The areas in red are areas where you might be feeling pain. You'll notice that it's possible to feel pain in a large area, but it might be attributable to just one or a few trigger points. You'll also notice that as you go through these maps, you can develop trigger points anywhere in the body where you have muscle. So before we get started on demonstration, we need to collect the tools that we need. First, it'd be important to find a firm ball. It could be a tennis ball, racquetball, or a lacrosse ball. And then I'd like you guys to try to find a long stocking or tube sock so that you can put the ball in it. An alternative tool that you can consider is a Theracane or something similar. And then lastly, if we're going to use the wall and ball technique, we'll need a wall or a high back chair. It's also important to know that there's some contraindications. We don't want to be massaging a pulse. We want to avoid any areas with open wounds. And lastly, we want to avoid massaging a lymph node. Before we do the demonstration, just want to point out that we are going to have two different techniques using our tools. Overall, I highly do advise using the tool if possible to reduce fatigue and possible overuse injury to your fingers and hands. These tools help us reach harder to reach areas such as the neck, low back, and back of the shoulder. And as far as positioning goes, we want to try to find a position that allows the muscle to relax as much as possible while you're working. It's counterproductive to be working against a muscle that is actively contracted or in a very stretched position. Alright, I'm going to demonstrate the ball on wall technique. You can also do this seated in a high back chair. The only tool that we'll need is our ball inside of a long stocking or long tube sock. Make sure you tie the ends. Let's just say that I have a trigger point in my upper trapezius muscle on the right side. So I'm going to find that location that I identified, place the ball right on top of it, and then using the wall, I'm just going to apply pressure on that location. And once I find it, it should feel a little bit uncomfortable. Again, that is the spot I'm trying to target, so we want to maintain pressure here. If you want to increase pressure, you can walk your feet further away from the wall in order to increase body weight. We want to maintain pressure for 30 to 90 seconds, holding on that one spot. Once those 30-90 seconds are up, you can slowly come off the wall and release. I'm going to demonstrate another spot where you can apply this. Say you have some buttock pain. Want to find that location, place the ball right on that spot that you identified, and again, apply pressure with your body weight as much as you feel like you could tolerate, and just maintain pressure here. Alternatively, there's another technique that where instead of maintaining pressure on that spot for 30 to 90 seconds, you can do really small circular motions in a unilateral or one direction manner so that you're almost kind of milking the muscle. And once you do this for 30 to 90 seconds, go ahead and release. And it's important to wait about 30 seconds before you get back on the wall and do the technique again. Alright, I'm going to show the Theracane technique next. It's not important that you have a Theracane brand per se, but I think an important feature of a tool like this is this hooked feature with a little ball at the end. I'm going to demonstrate releasing my rhomboid. So that is in between my shoulder blade. I want to apply that ball of the Theracane directly on that location, and then I'm going to basically pull across my body to apply increasing amount of pressure. We want to hold for about 30 to 90 seconds before releasing. Another position for that location is actually under the arm. Same spot, different kind of leverage. And again, I'm going to pull forward and across my body to get that kind of pressure I need to do a release, holding for 30 to 90 seconds. Another technique that you can use is also that small unilateral circular motion, like a stroke. And so we want to try to maintain pressure on the same spot, but we can also do really small circles for about 30 to 90 seconds before we release. So as a general rule of thumb, aim for a pain level that is about 5 out of 10 on the pain scale. Do not press harder for faster results. It's possible to cause further muscle spasms. You want to work on a trigger point about 3 to 6 times per day, applying gentle pressure until the pain level is about 2 or 3 out of 10. Don't expect to reach this goal in a single session. It's better to use short, repeated sessions and let the body do its job in between. If you flare or feel sore afterwards, this tells you that you've probably found the right spot, but you might need to be more gentler and apply less force and pressure next time. And lastly, continue massaging for several more sessions after the trigger point has been released or stopped actively referring pain. So what do we do after a trigger point release? If you feel sore after doing a self-release, you can apply an ice pack to the area you treated for a few minutes. Following this, it's highly encouraged for you to do gentle movements and stretches. Just note that stretches and movements are going to be found in the Trigger Point Resource Guide, and stretches and movements will actually depend on what body part you're working on. Some general guidelines for stretching include stretching in such a way that feels good, not painful. You also want to keep that stretch slow, fluid, and gentle. And then the result of the stretch should improve range of motion and provide a greater sense of ease. How do we promote longer-term effects of self-trigger point release once things are feeling better? Here's a few tips. Firstly, learn respect for your muscles. We're not designed to be in one position for long periods of time or in a fixed position, so vary your tasks each day. Be aware of how long you're sitting and standing for or how you're moving. Also, pace yourself. Take short rests frequently, especially if you're feeling muscle fatigue. Also, do a daily program of exercise, including stretching, moving, and getting your heart rate up, or aerobic activity. Learn and practice relaxation techniques and do them regularly. Those can include yoga, meditation, mindfulness, and deep breathing. And this can help decrease body and muscle tension. And lastly, be aware of what are possible triggering events. Consider what activities might bring on your trigger points. Are these activities modifiable? How can we adapt to reduce possible overuse?